All right, good afternoon, everyone. My name is Danae Aber. I'm the Executive Director of the Louisiana Rural Health Association. Thank you so much for joining us for this kickoff of our Rural Infection Prevention and Control Training Program. We are really excited to be able to provide this program through the sponsorship of Well Ahead Louisiana and in partnership with SouthernEVALS. Just a couple of housekeeping things before we begin. This webinar is being recorded. It will be available along with a copy of the slides on our website, and I will actually drop a direct link to the page in the chat box for you. Your lines are muted to prevent background noise, but please feel free to enter questions into the Q&A box. We will address those. You may be called on to speak at some point during the webinar to try to keep it interactive, keep you on your toes. So if we do call your name, I will send you a notification. You should get a pop-up that will allow you to unmute your line to speak. So be on the lookout for that if your name is called. After the webinar, we will have a brief survey. It should automatically open in your browser. You'll also receive it via email. And we do ask you to please complete that to help us continue to improve our future events, to make sure we're delivering you really good, high quality education. So with that, I would like to welcome Taylor Catano, who is a board certified infection preventionist and the founder and CEO of SouthernEVALS. SouthernEVALS is a regulatory compliance consulting firm that helps hardworking healthcare providers increase revenue and maximize patient safety. Taylor has a unique skill set combining infection control and regulatory compliance, where he helps organizations implement best practices in infection control while maximizing their ability to protect their patients and staff. He was recently recognized by the IFAH as one of the top 100 healthcare leaders in the nation and is one of 24 board certified infection preventionists in Louisiana, one of 1,000 in the entire US, and one of just over 5,000 in the entire world. Taylor has helped countless healthcare providers and organizations successfully obtain licensure, certification, and accreditation, all while most recently helping his clients navigate the COVID-19 pandemic. He has both a bachelor's degree in biology and nursing from Louisiana College. Taylor has previous experience as a frontline nurse specializing in critical care in both medical and surgical intensive care settings. His true passion has always been helping others, and his big goal is to increase patient safety from 1 billion patients by helping 10,000 healthcare providers succeed. So thank you so much, Taylor, for being with us today and for sharing your expertise with us. And with that, I will hand it off to you.
All right, thank you so much, Danae. Always a pleasure working with you and the team at LRHA. And hello to everybody out there. Welcome to our first webinar of the Louisiana Rural Infection Control Training Program. Super excited to be here, and without ado, we will get rolling. Let's see. Okay, so we have a pretty interactive platform, and I like to keep my conversation, open enough to where we can discuss, figure out who you are, where you're from. And just by looking at our list, I see Mr. Brad Taylor, I see Cindy Jacobs, Debbie Bales, Elliot Myers, Jill, Joni, Kathy, Nell, Peggy. I see a whole bunch of folks in here. And I want to start off by just bringing a few of you up just to talk about the good things that you've done, let some folks know who you are, and how long you've been in the infection control role. So let's start with Miss Kathy. You should be getting a notification.
Hello.
Hey, Miss Kathy, how are you?
I'm well, and yourself?
Oh, doing just fine. All right, tell us where you're from.
Originally from New Orleans, but I live in North Louisiana now, in West Monroe.
Gotcha. Okay. And how long have you been in the infection control role, and at what facility?
Off and on for some 20 odd years.
Great.
I right now work at Sterilization Rural Health Clinic. We have 3 rural health clinics, a physician-based practice, and a small 10-bed rehab hospital.
That's excellent. That is excellent. And if anything, I know you're joining us today, but if there was anything that you wanted to learn to get more information on, what would that be specifically in infection control?
I want to see if I'm doing it all right.
Totally understand. Okay. Well, yeah, well, we've got, you know, quite a few resources that we're going to go through along with some of the webinars. We go from basic to advanced. So hopefully we'll be able to get that knocked out for you. So nice to meet you.
Same here.
All right, let's go to, let's see, Danielle Riddle. Let's see. All right, Danielle, you should be getting a notification.
Hey, Taylor. I'm actually not in infection control, but I work at Bunkie General Hospital. My name is Danielle Riddle, and I'm the director of case management and utilization review.
Oh, great. Okay, awesome. Yeah, we know a bunch of folks at Bunkie General, and we know that their infection control program has been kicking it lately. But I know if there's anything that you came here for, what is it that you want to learn or get out of this?
I just like to make sure that we're always giving good quality care to our patients. So even though I work behind the scenes, I just like to make sure that we are within regulation and that our patients are getting the best care. And if anything's updated, we want to make sure that we stay on top of it.
Absolutely. Okay. Well, excellent. And if there's one thing you can say just from the outside looking in that you're proud of that you guys did, what would that one thing be?
We grew a swing bed program. We have really good care, take really good care of people, and people don't really know much about us, but the ones that do are blessed to come here, and we're blessed to have them.
Absolutely. And you know, those swing bed programs are so important to those rural hospitals, especially, you know, making sure those patients transition care. And there's a lot of infection control issues that come to light whenever we're dealing with that patient population. So I think there will be some things in here that y'all can definitely take from that. And then the last, so good to hear from you.
Yes, sorry, too.
And then let's see, the last, let's go with Peggy Millsap. All right, you should be getting a notification. Oh. All right, Peggy, do we have you? All right, maybe we lost her. Let's try Nell Olgwin.
Hello.
Hey, Nell, how are you?
Hi, I'm good.
Good. All right, where are you from and where are you working right now?
I'm with VALS Hospital in Marksville, Louisiana. We currently have 5 rural health, provider-based rural health clinics. And I'm in the same boat. I want to make sure that patient safety is first and all of our regulatories are met and we are in compliance.
Absolutely. Excellent. And if you could say one thing that you're proud of that y'all did for infection control, maybe through the pandemic, what was that?
That was not closing our clinics down and continuing patient care. We were fully staffed. We were able to take care of community patients in the community and give the COVID vaccine.
Absolutely. And that's such a big deal. You know, whenever that information came out and we didn't know if we needed to close our doors or leave our doors open, it's great to hear, you know, that y'all were able to keep those open, keep that care of the community. And I mean, what an awesome deal is being that source of healthcare in your community. So kudos to you, and very, very nice meeting you.
Yes, sir. Thank you. Likewise.
Absolutely. Okay, so that's kind of how it'll be interactive, is we can click in and out to let you talk about things. And as we go through some different items, I just want to, you know, have everybody involved to talk about maybe something that you're doing in your facility. And guess what? If you're not, it's okay. That's what we're here to learn, is what we need to add to our programs or to see if we have everything in place that we need. So moving on. So who is SouthernEVALS? We are Louisiana born. This is where I started my practice. We're compliance experts, all different realms, from small as a rural health clinic down the dirt road to a large academic medical center. We work when it comes to compliance, we work all things compliance. CMS, state accrediting bodies. We help folks really dig through those regulations and see where they need to be. And we're problem solvers. A lot of time we're faced with different problems. And there's a bunch of different solutions, but we try to work with our clients to find the best solution for them and for their culture. A few things about us. Our mission, as Danae mentioned, we help hardworking healthcare providers increase revenue and maximize patient safety. That's what we're truly passionate about. Our values are honesty, transparency, consistency. Anytime you're working side by side with a team, we feel that those are the huge pieces that you have to be successful and to move very efficiently. We add in hard work and compassion. You know, I've got a big heart. I come from a family of nurses, and everyone on our team has a heart for healthcare and taking care of folks. And our vision, huge stretch goal, just so that everybody's on the same page, is we want to be able to provide safer care for 1 billion patients. It's a lot of patients, but how we do that is we want to work with 10,000 healthcare providers to help them succeed with regulatory compliance. Because if you have your compliance down, patient safety usually follows. All right, so we're going to talk about this in chapters. We've got 4 chapters that we're going to go through today. Really, today is about learning about the program, what we're going to be able to offer, how to get signed up, a few basic concepts, and the top 3 survey findings. I didn't want to leave you guys that showed up for the first one without any content. But what I aim to do is give you the step-by-step details on how to be involved in the program, and then also give you some things that you can immediately go back in your setting and look and say, okay, I have that in line, or maybe that's something that I need to fix. All right, so I want to start with a story. So does anybody recognize this man? And you can go into your toolbox on your participants tab and you can raise your hand. And you can participate that way as well. Does anybody recognize this man? So let me tell you a little bit about this man. This man was a phenomenal baseball player. He played for Loyola University. He was a shortstop, and he had all conference honors, all the above. He was an amazing baseball player. He was an amazing man. He raised a family of 7 kids. All 7 kids went on to have a family. You can see some pictures right there. He was a loved grandfather. And something about this man that sticks with me and why I tell his story is that he was one of the few folks that was very close to me that contracted COVID-19 and ended up passing away from that. Those emotions that go along with that, you know, I got to see my wife's family suffer through a time where they couldn't be with their loved one. I got to see them having to go one by one to visit him. I got to see them, just going through the emotions of not being able to have a normal wake ceremony, a normal funeral ceremony. And those things really stuck with me. And it really, through this COVID-19 pandemic, you know, there's been so many challenges that many of us have gone through. I know probably most of you have had someone personally that was affected by COVID-19, and never before did we see more focus on infection prevention and control. You know, from our experience, we had a basic idea of what we needed to do in the healthcare realm, but this did not discriminate. When we talk about courtrooms, when we talk about folks that work in plants, when we talk about folks that work in schools, infection prevention and control is at the top of mind. And there was a lot of gaps that were made. And unfortunately, there were a lot of lives lost. So I always beg the question is, you know, if we can do something to change or save a life or save or protect our patients and staff, will we do it? Absolutely. I think everybody would agree that if we can do things to make a difference, that we absolutely would. And that's why I have this slide, is you too can make a difference. A lot of these little things that we talk about lead up to a bigger picture. And that's a safer practice. That's a safer community, or a safer environment for your community. And that's a safer environment for your staff as well. So it's up to you as a leader to make positive changes that will have a positive effect on your community. Okay, so our first chapter, we're going to get into details, the RIPCT program details. What is it? You know, what are we going to actually be doing? What's all involved? So the basis of this is educating rural hospitals and rural health clinics on the most up-to-date evidence-based practice to ensure that you have regulatory success and utmost patient safety. The partnership, just a little bit about who is involved. So the LRHA was working with the Louisiana Department of Health Bureau of Chronic Disease Prevention and Healthcare Access. A lot of you recognize that as well ahead, to deliver this program in accordance with the CDC's initiative. So the CDC has a goal of decreasing the health disparities among populations of high risk and the underserved. And a big piece of that is doing some education and making sure that our healthcare providers are educated as to what is required, what best practice is, and how to do those things, how to implement those things. So they wanted something tailored to rural hospitals and rural health clinics in both a virtual and in-person format. And that's what we're going to be able to do. So the partnership began. We submitted a proposal, and we were able to work something out with Louisiana Rural Health Association to do just what the CDC and Wellhead aimed at doing. So there's going to be three main elements, and those three main elements are what the CDC is looking for. The first thing we're going to be doing is a series of webinars that educate all things infection prevention and control. So whenever we talk about regulatory requirements that are required for rural hospitals, or we talk about regulatory requirements from accrediting bodies for RHCs, we're going to cover all those basics. The second piece is on-site visits. This was something that we're very excited about because we can say exactly what you need. We can give you the things that you need to look for, but having an outside set of eyes coming in to look at your facility, maybe put eyes on your documents and be able to tell you exactly where you need to improve things or where there may be deficiencies is something we're very excited about. You know, one thing that we always say, we talk about, we call it the bubble effect. If you're in an environment, many times you go there every day, you look at the same things over and over, there's always a chance of something being missed. And with a third party set of eyes coming in, we may be able to recognize something that may be a small deal or it may be a big deal in the grand scheme of things, but we can help you mitigate those things or put those documents in place, those procedures in place that'll help you succeed in a regulatory environment. And then the last thing is the biggest thing that I think, and Danae can talk about this as well, but not many times in grants do we get the opportunity to actually give something other than education. This grant actually gave us the ability for 40 sites. We'll be able to get custom packages of PPE, infection prevention and control supplies, infection prevention and control technology, mitigation mechanisms, or some signage. It gives us the availability to actually give items to clinics and hospitals. So we are super excited about that. And we'll talk a little bit more about that in the webinar about how that's going to happen. Okay, so webinar dates. These are some dates that we are looking at. So you'll see whenever it comes to the webinars, that's the first element. The webinars are going to be spaced out fairly equally so that everyone has a chance to do those. So you can see today's the project kickoff, but we will have the infection control prevention basics coming up on June 15th. So that'll be the first one that we do. The basics are going to be looking towards everything, trying to cover at a high level what's required for hospitals and what's required for RHC. So you can see that we separate those so that you know specifically which ones you need to be on. Then we do have towards the end of the schedule, we've got the advanced dates. Those advanced things go into things more like high level disinfection, sterilization, some high level or intricate or technical processes that you're doing in your practice that we want to make sure that you're following all those steps or making sure that you have all those things in place to practice safely. So jot those down, and Danae will put some links up to where you can register to those, and it'll give you some calendar reminders when those pop up. Okay, so explaining the basics. So the basics on that webinar, we're going to talk about the 3 Ps. So the 3 Ps are what we like to call the foundation of your infection prevention and control program. So those Ps, number 1, paperwork. So in any program, especially infection prevention and control, when you're dealing with entities like CMS, with the state or accrediting bodies, they've got certain documents that they want you to have in place to make sure that you are covering your bases. So we're going to be reviewing all the paperwork elements required. Some of those including infection control plan, your infection control approval, giving you the approval to do those things that an infection preventionist is able to do. A risk assessment where you identify your risks and you look at your geography to see what you need to focus on and where you need to focus your efforts. An evaluation, looking at the program as a whole, what worked, what didn't work. And quality data, what needs to be tracked, what needs to be trended, and how those things need to be reported. So that's your paperwork side. The next thing we're going to look at is policy and procedure. So we want to make sure that the policies and procedures that you have in place are following your best evidence-based practice. We want to make sure that when you're creating those, when you're editing those, and when you're implementing those, that sometimes we don't want to, be super specific. We want to speak to the process, but we don't want to back ourselves into a corner, or we don't want to say something that's going to be unrealistic in our program or for our staff to follow. So we're going to give tips that'll help you increase compliance and then also have success during your survey. And then the last thing is practice. When we talk about practice, that's the day-to-day things. Making your infection control rounds, some of the things you want to look for when you're making those rounds around your facility. Your surveillance activities, whether that be hand hygiene, whether that be if logs are being complete, we're going to talk about those things. And any items that you need to do on a daily, monthly, quarterly, and annually. So, I'm a checklist guy. I like a checklist. And with all these educations, we're going to be able to provide you a checklist so that you can go back to your setting and you can make sure that all those things are being done. Or whenever you train someone, you can give them guidance as to what they need to do on those increments. So what we aim to do is turn this into this organization. And what we say about, when it comes to the basics is if your surveyors know where to go, the survey is going to flow. A lot of times you can always beat a hurdle with a surveyor is if you can have your documents in order, you can have it spaced out or tabbed out with what they're looking for, and then they can really spend time with you talking about your program. So that's a tip right there. Okay, then we're going to work into the advanced. So the advanced presentation, we're going to talk about more technical aspects of infection control. So you can see the first thing we're looking at is high-level disinfection and sterilization. We want to review the evidence-based practices and procedures when it comes to those things in your operating room, your procedure room, or even if we're doing some of those things in a rural health clinic setting. We want to make sure that we're taking care of all those items and doing those things the right way. We'll be touching on transportation of instruments. We'll be touching on manufacturer's guidelines. We'll be touching on the environment that this takes place in. So we'll be looking at all those different things. HAI versus CAI determination. I know in our practice, many times if a new preventionist comes in or could be a seasoned preventionist, this is one of those things that is few and far between, are very hard to determine if you haven't been educated in that. So we really want to do a deep dive into what compromises a healthcare associated infection versus what a community acquired infection is. At the end of the day, we don't want to blame ourselves for something that may have happened in the facility. We want to make sure that we do the research and we follow those definitions from the NHSN to truly determine if those are healthcare acquired. And then the last thing is technical knowledge. So when the different technical points in the infection prevention and control program that you may not have in place that we've seen in our experience that'll help you move the needle forward, whether that's getting staff engagement, whether that's an innovative way to trigger an activity. We're going to talk about those technical elements that we found success with our clients. So, when we talk about technicalities, we see a whole lot of stuff. And if you look at the picture on your left, that's definitely not what we want to do. That is not the proper process. What we want to do is, like our quote says, step by step by step. We want to make sure everything in those processes, everything that we do has a procedure to it, and those steps are followed and our folks are trained. So you can see a good organized environment. And that's what we want to make sure that you have when it comes to those technical aspects of your infection control program. All right, on-site training. So this is going to be the second piece. And what that looks like is we are going to have a team of experts. So I mentioned my team before. I'm a board certified preventionist. I will be on many of the site visits. I also have folks that we train that are either RHC certified or I've deemed them competent through infection prevention and control, my certification with APIC and the CBIC. And they are my eyes and ears. They help our clients identify those different things through environmental rounds that they need to do, and then also can look at your documents to do that as well. So the first thing that we'll be doing is a document review. Our consultants will be on site working with you, looking at your documents to make sure that you have all the pieces in place, number one, and then number two, that everything that you have in place adds up and that your policy matches your practice. So that'll be the first piece of that. Second thing we're going to do is a facility tour. So we want to look at all aspects. We're the good guys. So we want to come in and we want to be beneficial. While we're on site, if there are things that you want us to look at, maybe your storage rooms, maybe your organization of how you keep a room, maybe it's your OR, maybe it's your procedure area, or maybe in a clinic, it's just looking at your process for your vaccinations, how you keep those, or disposal of biohazardous waste. You know, that's what we're going to be there to do. And we're going to come there with eyes to be able to identify, hey, look, this may be something you want to work on, or everything looks good. You know, these may be some things that you can put into place to bolster your practice. So we'll be able to do that. And with those facility tours, we will have a checklist that we'll be sharing with you so that you can either train your staff or that you can perform those rounds as well to make sure that those things are in place. And the last thing is we want to wrap our days up with a Q&A session. So anybody that you want can come to those Q&A sessions and they can ask any question that they want to about infection prevention and control. If it's something that they've heard about and they want to know what others are doing, we can talk about that. If they want to hear about different things that have been cited or how the surveyors ask those questions, we can talk about that. But we really just want to be a base of knowledge to where anybody in their different departments, we can talk to them and answer those questions for them. All right, and what we are so excited about is the custom PPE packages. So infection prevention and control resources delivered. What we've really been looking at is the best way to do this. And I think Danae has the best idea of this is going to be your choice. So what we're going to be doing is we're going to be identifying a list of items that are going to be available to you. And you can go through that list of items and choose what you want in your clinic. So in your clinic, say that you have a shortage of N95s. Maybe that's going to be something on that list and you can choose to get those. If it's something in your hospital setting, like maybe there's a PAPR system that you wish you could have got or some new technology, we're trying to get some of those items on the checklist to where you can choose from those different things. So those resources, we want to cater those to your setting and what's going to make the biggest impact for you and something that you can use moving forward. So those resources, like I said, they may be N95 masks, gloves, gowns, air filtration units, PAPR systems, UVC technology, a vast array of items. And really, we're going to work our tails off to make sure that we give a big option, you know, a large amount of options to where you can go, you can select what works best for you, and you can put those things into practice or utilize those immediately. And the best thing is delivered to you. So whenever we come for our on-site visit, we're going to show up with our team to do that walkthrough, to look at your documents, but also that PPE will be there. And you can, you know, at that point, we'll be able to give that to your staff. You know, it's something that we're very excited about, is getting some supplies out there, possibly some things that you need or possibly some things that you've been wanting. So excited about that. So I will just saying that, I'm going to open it up. I would like to unmute, let's see, Miss Marge Wiggins, if we can. All right, Miss Marge, can you hear me?
Yes.
All right, Miss Marge, if you had to say, well, first off, tell us where you're from and how long you've been in the position.
I'm from Coshada, at Christus Coshada Healthcare Center. I've been in the role for almost 3 years now.
Great. That is awesome. That is awesome. And if you could say with those PPEs or with those supplies, is there something that you know right off bat that you would like to receive in those packages?
Not that I could think of right off the top of my head, but I am sure that talking to other staff members, we could come up with some items.
Perfect. Perfect. Awesome. Well, very nice to meet you. And yeah, definitely be thinking about those because you'll be able to put some of those ideas in the next application that we put out. So very nice to meet you.
Nice to meet you too.
All right. And I will call on next. Let's see. Is Allie. All right. Can you hear me?
Allie, you should have a pop-up that allows you to unmute yourself.
All right. Let's move on. How about, let's see. How about LaShayla? Let's go with LaShayla. right, can you hear me?
Hello.
Hey, how are
Uh-huh.
you?
I'm good. How are you?
Oh, good. All right, tell everybody where you're from and how long you've been in the role.
My name is LaShayla Greenhouse. I'm from Mooreville. I've been at Bunkett General as a case manager since last April.
Awesome, awesome, awesome. And if you had to say what you think would be the best thing for your hospital in terms of PPE or supplies, is there something that comes to mind?
What's that again? I'm sorry, I didn't understand the last part.
Yeah, I was saying if there was any supplies when it comes to infection control or different technologies, is there anything that you can think of that you would like to receive?
Uh, Mask maybe, which I don't think I've really noticed a shortage, but I mean, we can never go wrong with masks.
Nope, absolutely. I agree. I agree. Well, good to talk to you and thank you so much.
All right, you're welcome.
Absolutely. But yeah, those are going to be things that we really want participation from is, you know, if there are ideas or things that you've had on your list that you've been wanting, let us know. And then we can reach out to those vendors to try to get those as we're building those packages. So, okay, we're going to close out chapter 1. That's a little bit about the program. The next thing is how do we sign up? So you can see the program is going to be available to 10 rural hospital sites and 30 RHC sites. So here's going to be the steps that you need to take. So we've created, Danae and I have been working on this, and we created an assessment application. So what this looks like is once your link is open, what you can do is complete the Infection Control and Prevention Project on-site assessment and education application. And what that is it's going to go through specific questions for rural hospitals and rural health clinics. And it's going to identify what different areas that you do. So are you a clinic and you have in-house housekeeping, or do you have outsourced housekeeping? Are you a clinic that does high-level disinfection in-house? Are you a provider-based clinic? Are you an independent clinic? In a rural hospital, do you perform procedures? Do you have an operating room? Do you have a decontamination area? What different services do you provide? As an infection preventionist, how long have you been in the role, or are you brand new? So it'll ask all those different questions, and based off of the answers to those questions, we're going to rank the facilities that have the highest need, and those are going to be the folks that'll be in our program. But I'm going to give you an insider tip. Move fast. So the tiebreakers, one of the things that we said is the tiebreaker is going to be who completed the questionnaire first. And so there's a whole lot of people in this webinar. So we want to make sure whenever that's opened up, you go in there, you answer those questions, so that you can be in, you know, put into the drawing to enter that. So again, we've got 10 spots for rural hospitals and we've got 30 spots for rural health clinics. So it's going to be easy as that. You know, Danae will pop that link up as soon as it's available. We'll get that to you. You should be receiving an email, and then you can go and fill those things out. So, all right, it's easy as that.
Taylor, I'm actually going to jump in. They are open right now. I just popped them in the chat.
Okay, beautiful. So yep, that link is in the chat. You can go there, you can save that, or you can start working through that as we're talking. But yeah, it's just great to get that done as soon as possible, just so that we can have you in there. And also if there's a room for those notes to put what you'd like to get in that supply package, also mention those things. So either there or email us. So, okay, now I want to get into a little bit of content. I want to share some things that are of value that where we can start framing our mind about these assessments, about how we need to look at our program. And really what I want you to do right now is take a second to really visualize your facility and the different concepts that we talk about. Each scenario we run through, really think about where you are in your facility. So the first thing we talk about is linear flow. Linear flow in healthcare, usually we talk about linear flow as a movement from dirty to clean. A lot of times you hear about linear flow in a decontamination area, or in an OR where we go from dirty to clean, or even in a patient room in a clinic setting where, you know, we go in one way with a sick patient, we exit a certain way and we clean behind those folks. But linear flow also talks about a couple of different things. You know, linear flow talks about how we move from a problem to a solution, how we move from bad to good. So whenever we're thinking about linear flow, we want to think like a surveyor. And the first point we're looking at is flow through your facility. You know, whenever you look at your facility from the outside, what's the first thing that you see? Do you see notifications as to if you have a mask requirement? Do you see signage up? Do you see resources that are available for patients to decontaminate their hands or disinfect their hands? And available resources for masks for folks that didn't have one, or the mask look like it's been run over by a car 100 times. You know, do we have those resources available? As we're walking through, do we have someone that is doing that questionnaire? Moving further into it, whenever we move into the room, how do we make sure that once that sick patient enters that room and they exit that room, that we're cleaning properly? So I want you to start thinking through how you function through your facility. You know, when it comes to rural hospitals, what is the flow for your housekeepers? Are your housekeepers moving a dirty cart in and out of a room, or are they keeping a consistent process as they clean? What is the process whenever we have an isolation patient? How are we making sure that we go into that room protected and then we exit that room properly, don and doff, to make sure that we're not spreading any infection? When we look at our high level disinfection process, what's the flow there? Are we going from a dirty, let's just use a scope, for example, are we going from a dirty scope, cleaning that, going to the process to make sure that it's clean and then storing that properly in a clean environment? So as you think through linear flow, think through all those processes that we're going to be talking about through this webinar series, and think about how you're moving from dirty to clean, how you're moving from one area to another, and making sure that we're not cross-contaminating or moving anything back into that area. How about the flow of your plan? When we think about linear flow, what about how we make sure that our plan is consistent with what we're doing in the facility? You know, what's our process? What's the flow from when we identify something to when we actually put it into motion and correct those things? What's the flow of whenever, you know, let's say we have an outbreak? How do we flow, or what is the process? What's the investigation process? How does it flow from being an investigation to identifying what may have caused that, to remedying the problem, to changing the procedure on how we do that? What's the flow of surveillance? You know, whenever we identify things in surveillance, let's say that we're not cleaning per our disinfectants cleaning time. What's the process to make sure that our staff are educated on that making sure that that's the best product to use, and making sure that consistently we're going to make sure it's done correctly? We want to make sure that those issues flow correctly and be able to evidence that. And that's where we go into the flow of documentation. You know, one of the things is having clear evidence of what we do on a day-to-day basis. So what's the flow of our documentation? Are we showing our data? Is it trending? Are we looking at month over month, week over week? How are we looking at those different things? Are we even tracking data? Is there even a flow of information that's moving from when we see it at the base level to the administration, governing board, medical exec, and then coming back down, or in a clinic setting? If one of our staff members identifies something, how are we getting that to the clinic director and then remedying those things before it becomes a part of the culture and an issue that's not addressed? So just to think through linear flow, you know, linear flow will be a lot about what we do when we come into the facility, is looking at the paths, your care paths, looking at how your path to reaching your goals is, and then looking at the documentation, which will give us a clear path into if the things were fixed or if they were not even identified in the first place. So that's the first real topic, is linear flow, movement from either dirty to clean, problem to solution, good to bad. So when we talk about surveyors' eyes, like I said, is, you know, we've worked with hundreds or thousands of surveyors, and just to be completely transparent, about 5% of those specialize in true infection prevention and control. So you need to realize that the surveyors that are coming into your facility, whether they're state surveyors, LDH surveyors, CMS surveyors, or whether they're accrediting body surveyors, Quad ASF, TCT, Joint Commission, DNV, you know, those aren't specialists in infection prevention and control, but what I can tell you is that there are a list of items that the surveyors are briefed on in general, if they're covering those topics, that they will be looking for specifically. Those things trend and change. And so, you know, we've been able to keep up with those trends, and we're going to be able to share with you what we've seen just in the past year through COVID-19 and keep you up to date as we work with you. So surveyor eyes walking up to your facility. You know, what are those things that you think they're going to be looking for? You know, waiting in your facility, a waiting area. What do you think would be conducive to infection prevention and control that they may be looking for? Your patient care area, your patient rooms. You know, how are we going to make sure that those areas are set up or that are organized in a way that proves infection prevention and control? And when they go to look in those areas, that you know, they are ready for a surveyor's eyes. Dirty, clean storage areas. You know, we talk about things that are supposed to be stored in certain places. Whenever we talk about clean and dirty storage, do we have a true separation? And do we make sure that those things, when a surveyor passes through, that they can identify what is clean and what's dirty? Do we have a process behind that? And then equipment processing area. So equipment processing, that's a big one that's going to be technical. That's when those surveyors are going to be looking for making sure you follow manufacturer guidelines. So think through with the surveyor's eyes about what they're going to see. All right, and the second topic I really want to touch base on is tracking and trending. So the top comment from surveyors, I get it every time. And it's just, we're busy doing what we're good at, is taking care of patients or taking care of our business in the facility. There's all kind of things that can come up. But the top comment we get from surveyors is, look, you've got a ton of data. You're doing a lot of work. But what are you doing with it? Where's the evidence behind what you're doing with this data? And so off to the left, that's why we put this, is you got to give yourself a little bit of credit. A lot of times, many of the survey findings can be mitigation. You know, we work with CMS surveyors and they've told us that, you know, if a facility is identifying problems and they are notifying those and they've got a plan about what they're doing and they're working on fixing those things, many times they don't cite those items, you know. But if they find something and we knew about it already, that's when it gets frustrating, is, you know, if we have something that could be fixed or we could be working on, why are we not working on that? And we don't have any documentation backing up what we're doing. So that's a huge piece of that. You know, give yourself credit. Whether it's tracking, you know, from an RHC, I know a lot of the times we recommend tracking hand hygiene, tracking flu vaccine compliance, looking at especially COVID-19 vaccine compliance. Track and trend those things. Show your progress through, you know, through tracking and your processes. And when you identify things like 100% compliance across the board, maybe change up how you look at those items, but make sure that you give yourself credit for those. And look, there's many ways to do it. You know, we're going to talk about a shorthand form that we use, but there's a lot of ways to evidence what you do, whether it's just a paragraph or a full-blown quality project. You know, you want to make sure that you evidence the good work that you're doing, which I know a ton of you out there have done amazing work during COVID-19. You need to give yourself credit for that. And the surveyors are going to commend you for that. It tells the story. It's just like reading a story about what happened, what you did about it, and how you fixed that issue or how you mitigated that problem to protect your patients and staff. So insider information, this is what we use for many of our clients. It's a very easy concept. I learned it in nursing school, but plan, do, check, act. It is an easy way. We call this survey insurance. This is an easy way to evidence a full cycle of corrective action for any deficiency or any deficient practice found in your facility. And it's a very easy item to do. So you can see in this one, what we focused on was expired supplies throughout the facility. So the first thing we do is we've identified that that's a problem. Okay. We saw that maybe we were out of date by a month. And I mean, some of you can relate. Sometimes there's stuff we find that's a couple years old. It's just a matter of, you know, what happens. We're busy practicing and caring for our patients that we don't pay attention to those details. So it happens. But we can document what we did about that. So the first thing would be is to develop a plan on what we want to do. So is your plan to assign department managers to round on or look at supplies on a monthly basis? Is it having your front desk go and pull 10 supplies out of the closet to make sure that they're not expired? Or is it putting a full-blown system to where you color code things? I've seen all kind of different ways of doing that. So, you know, we want to make sure that we have a plan. The next thing is what you do. So talk about what you did about that. Did you create that system? Did you go through with that system? Or did you go through and do a full-blown sweep and pulled out every expired supply and donated it to a nursing school? Or what did you do? Tell your facility or the surveyors what you did. The next thing is check. This is when we go back to make sure that what we did actually made an impact. You know, did we go back and our system worked? We didn't find any expired supplies, or did we go back and there's still a pile of them? You know, that is when we go back to verify that our action, was it effective or was it not effective? And the last thing was take action. So if your process worked great, then continue with that. If it didn't work great, go back, start the process over, and get a new plan, start a new process. So this is something that we utilize in our practice that has saved us a ton of times whenever it comes to issues that may take a while or be a cultural change. This has been something that we can evidence, hey, look, this is what we're doing. We're actively doing that. And if we have data to back it up, we can give that, and we can a lot of times evidence what we're doing, give ourselves credit for what we're doing. Okay, we're going to close out that chapter, and let me just check question and answers. Let's see if we have any right now. Let's see, I don't think I can pull those up, Danae.
Hey, Taylor, I did answer a couple while you were talking.
Okay.
So one question was about how to get to the site, how to get to the application. Those are in the chat box, so check those out there. And then they asked, who can they reach out to for questions? So general questions about the program itself, you can reach out to me. I'll put my email address in the chat. And then specific infection prevention control questions, I cannot help you. So I'm going to send you to Taylor, and I'll put Taylor's email address in the chat as well.
Perfect. Okay. All right, let's call on some folks to get a little insight. All right, let's go with Ms. Peggy Gotro. All right, Ms. Peggy, can you hear me? Let's see. Ask to unmute. You should be getting a notification. All right. Well, we can't get her. Let's go to Ms. Catherine Brooks. All right, Ms. Brooks, can you hear me?
Hi, Taylor.
Hey, how are you?
I'm well. How about you?
Oh, doing just fine, Okay, tell me, where you from? How long you been in your role?
Yeah, I'm over here at the Bunkie General. I'm across the
Okay.
hall from Shay and down the hall from Danielle. Hi, guys. And
Perfect. We got a lot of people in the house at Bunkie General.
we do.
Excellent. Okay, so tell me about a process whenever y'all are tracking anything in your quality. I know that we collect a lot of data. Tell me about how y'all are evidencing the good things that y'all are doing.
Well, I'll tell you what, I'm director of therapy. So once a month I fill out our infection control nurses chart that talks about, the observation of the hand washing, and now the mask compliance goes through a checklist of equipment and who's in charge of cleaning what. Once I turn it in, she works her magic with it, and that would be a great petty question for beyond that.
Perfect. Yep. Partnering with the infection control, your practitioners is going to be a huge piece, and a lot of the data they collect, they report that up. But each of those different departments, they're looking for specific things. So no, thank you so much. I appreciate that.
No problem. Thank you.
Absolutely. All right. And I see we've got Todd Acosta. Let's see. Can you hear me? Let's see. All right, give him a few seconds.
Can you hear me?
Oh, there we go. I sure can. How you doing?
Doing fine. I'm the chief nursing officer at Hood Memorial Hospital in Amite, Louisiana.
Okay, awesome. And then do you perform the infection prevention control duties?
No, being the chief nursing officer, I'm over it. We do have somebody here that is over that, Felicia. And we have a cooperative endeavor with North Oaks they help us with that right now. So we're evaluating. We have a survey year this year, and we're in the process of evaluating everything. And this is a perfect webinar for us, actually.
Excellent, excellent. Yeah, I mentioned that because a lot of times in rural healthcare, we wear a lot of hats. And so sometimes our directors of nursing, chief nursing officers, they function in a lot of different roles, but that's great that you have the resource. All right, so what a great question would be is, how do you, or your involvement with infection prevention and control in doing some of those projects? Do y'all have a process for tracking the good things that you do or talking about those good things?
We do. We have things that we track, of course, as everybody else, but we would still like to fine tune it and update our processes and look at just better ways to do things here to capture the data.
Okay, perfect. Yep, absolutely. All right. Well, very nice to meet you.
Thank you, Taylor.
All right. So last thing, so that we're going to close that chapter out. And the last thing we're going to talk about is the top 3 findings. So on a month-to-month basis, we spend a lot of the time on the road working with clients through surveys. It's one of the things that we do. And after the 20 plus surveys in the past year that we've worked, these are going to be the top 3 things that you can go back immediately to see in your practice if you have these things in line or you have a process for these, or if there's some items that you need to fine tune and make sure that you tidy up before your survey. So top 3 things. The first thing we're going to talk about is rural hospitals. So the 3 findings that we've seen most frequently is number 1, water management plan. This was something that was brought up a few years ago. It was a big emphasis with the CDC. They pushed it. They wanted to mitigate the spread of Legionella, but a water management plan. And what happened is some things went into place the beginning of this year to where there are a full list of documents that you need in your water management plan to be in compliance. So we want to make sure that we identify those, and we're going to talk about those more. Second thing, the top thing that is cited in ambulatory surgery and rural healthcare across the board when it comes to rural hospitals is sterilization, high-level disinfection process, and not following the manufacturer's guidelines. So many times what we see, missteps, incomplete documentation, and we'll talk more about that. And then the last thing that we've seen that's been cited has been the COVID-19 vaccination mandate non-compliance. So there's a couple different ways that we've seen surveyors look at that and how they've cited that. And we're going to talk about all those different ways here in a second. So the first thing is water management plan. And Danae, I did want to ask, I put links. Can you click on that link?
We cannot click on them, but you should be able to click on them on the PDF of the slides when we put them on the website.
Perfect. Okay. Yep. So what I did is in these, I just went ahead and put the reference for everybody to see where these came from. But the first thing is a water management plan. Like I said, this is not something that's very different for hospitals. I know a lot of times our facilities take care of this, but sometimes facilities have so many things going on, whether it's making sure that the fire marshal has what they need, making sure that the life safety elements, the generator, the sprinklers, they have a whole lot of things. This is something that may go by the wayside. But it's something that surveyors have been looking at with scrutiny, and they want to make sure that you have all these things in place. So the gist of this is making sure that all of your water systems are identified in your facility, and that where there are risks for Legionella or other waterborne illnesses or things, waterborne illnesses to hide, they want to make sure you address those and you have a plan to mitigate those things. The new regulation is very specific. So it gives you exactly what you need, like we talked about that checklist, but they want strict documentation as to the following things. So number 1, you want to have a team. You want to identify a team that's going to be over the water management plan. A lot of times we see facilities involved, we see safety involved, we see infection control involved, really whoever, those are the 3 main ones. But if you want to get other folks involved, you want to identify those folks as the team. Second thing is you want to make sure that there are goals that you identify, mitigating the risk. We want to make sure that if we have water breaks, that we follow the steps to make sure that nothing was spread and that we do the right procedure. You want to set goals to make sure that there are, you mitigate those risks as much as possible. After that, you want to make sure your team assigns a plan manager to oversee the implementation and documentation of the plan. So now we have the evidence that we are moving forward with our plan. Fourth thing is you want to create a diagram, which this is something that infection preventionists can work with, for identifying where water comes into your facility and get as detailed as possible of how that is distributed throughout the facility and where those things go. So if you have different hot water heaters, if you have boilers or chillers, you know, does it come in from the street and then it gets dispersed this way? Does some of it go to hand washing sinks? Does some of it go certain areas? So you want to work with your facility manager to make sure that you have a diagram of where your water goes. Next thing, you want to make sure that in your plan you address what you do if you have construction activities, if you have water breaks, or if you have stagnation in a unit, say you don't use a unit very often. You want to talk about things that you do in there to mitigate risks whenever those things happen. Last thing is you want to evaluate. You want to evaluate that. Do you have areas of immunocompromised patients? Do you have areas where they're going to have dialysis and they're going to be using water, or different areas where those pathogens could be spread? Or do you just have a sickly population that we're moving on to a unit that hadn't been used before? You want to look and evaluate your patient population or the services that you provide to make sure that there's no risks there. And then at the end is continuous monitoring and setting protocols for acceptable ranges. So do you look at chlorine levels? Do you get a test kit off of Amazon and you're doing point of care testing? Or do you have a company that comes in to do your testing? So you want to make sure that when you're talking about your water management plan, a lot of pitfalls that I see is, number one, you don't have all those documents in place. And number two, that if you hire an outside company, they're going to put in your water management plan a whole bunch of things that you may not be doing. Frequencies of testing, how you do testing. You want to make sure that whatever's in your plan is consistent, and you work with facilities to make sure that those things are in place. So that's the first thing that we've been seeing cited. Second thing that we've been seeing cited is sterilization, high-level disinfection. I put a link. One of the best resources that we found is the Joint Commission's high-level disinfection booster pack. It is a wealth of resource or wealth of knowledge when it comes to sterilization, packing instruments, when it comes to high-level disinfection, and it talks about what classifications need to be used when. So this is the most frequently cited deficiency when it comes to when it comes to protecting patients from infections from inadequate process equipment. And the Joint Commission literally said this: the most vulnerable locations for lapses in sterilization or high-level disinfection of equipment are ambulatory care sites, including office-based surgery facilities and decentralized locations in the hospital, folks that are off. Even though the data shows higher non-compliance rates for critical access hospitals and hospitals. So why is that? And a lot of these things happen because of these common lapses. Number one, there's insufficient training or a lack of competencies with the sterilization equipment or how to do that, or the high-level disinfection equipment or the chemical being used. Second is lack of leadership oversight. So whenever we talk about train the trainer, maybe you have a director over a surgical area or over a procedure area. Maybe they lack the oversight or competencies to where they couldn't teach somebody. So you want to make sure that they have oversight and that they're trained in that position. The third is manufacturer's guidelines. So there's so many manufacturer's guidelines. You want to go look at the solution you're using. Does it require you keep it at a certain temperature? How long is it good for? Are you labeling that whenever you put it in a container? And is it caustic and needs to be in negative pressure in an environment where it's vented? Those things you need to look at. When it comes to testing that on the test strips, is there a requirement to test your test strips? A lot of manufacturers' guidelines can have real detailed information, and an unknowledge or a surveyor that's not very knowledgeable about the process, they dive straight into manufacturer's guidelines. So they'll ask you to pull those and they're going to read straight from those and ask you, are you doing this? So you want to make sure that whatever you use, you make sure that it's following those guidelines. Next is no designated staff member assigned to sterilization or high-level disinfection. That comes in the inconsistencies. So one person may process a scope different than another person, or one person may do packed instruments differently than another one. Some may keep it clamped, others may leave it open how you need to. So inconsistencies happen. And then the last thing is your facility design, ventilation, or space issues prevent proper process of sterilization or high-level disinfection. So does your room require ventilation? Is there a process where, like we talked about before, there's linear flow? We take dirty instruments or dirty equipment and we process those, we take those out clean and we store those clean. So thinking through those. All right, and the last thing is COVID-19 vaccine mandates. This is something fresh on everybody's mind, and we've had to keep documentation of our exempt staff and the folks who have gotten the vaccine. So things that we're looking for is the top statement talks about Medicare and Medicaid. What they've been deemed to do is make sure that you're doing it, and they're making sure that you follow your procedures. They don't want to fine you. They don't want to, well, they may want to fine you, but they really don't want to take your license away. They don't want to terminate you from the program. They've just been given this mandate to where they have to go make sure you're doing what you need to do. Sole enforcement remedy for non-compliant hospitals and certain other acute and continuing care providers is termination, but they, like I said, they don't want to do that. So let me tell you the common lapses in this. Surveyors are going to look at this and make sure that, number one, you've got your evidence and your documentation of all of your employees and your contractors. Many times, contractors, we can define those how we want to. A contractor that comes on site every week, I feel like they would definitely need to have evidence of vaccination or an exemption, but a contractor that comes on maybe once a year to look at something, we may not need to have that documentation. It's all going to be about how you define what a contractor is and what contractors need to have evidence in your policy. That's what the surveyor is going to look at. Second thing is not following your policy and procedure for the unvaccinated staff. So surveyors and the mandate says that we need to do something above and beyond for those folks who are unvaccinated or who have an exemption to make sure that they're protected and they're kept safe from spread. What does that look like? We need to make sure that in your policy that we're following whatever we do. Many facilities that have got cited for this, there's policy said that the unvaccinated staff or the exempt staff needed to wear N95 masks. When the surveyor went on the unit, talked to one of those unvaccinated staff members, they know the policy and the patient wasn't following the policy. The staff member was not following the policy. So there goes the citation. One thing is you don't have a policy for COVID-19 vaccine mandates that may be housed in HR, but as infection prevention and control, you need to have access to that and be able to have that resource available to your staff. And then you don't have proper documentation of all employees. This can be done a multitude of different ways. Do you have their cards? Have they filled out paperwork? But you need to be able to evidence if they pull those files that you are 100% compliant, and you've got a process for folks that come in to make sure that they're compliant. Okay, moving on to the rural health clinic. We want to make sure these three things are the top three things that are being fined. Number one, supplies expired and not labeled and dated. So this is per policy or manufacturer's guidelines. Number two, again, sterilization, high-level disinfection process is not per manufacturer's guidelines. So there again, you see how important that is whenever we get into the technical piece of disinfection, sterilization, high-level disinfection. You want to make sure that we're following those. And then the last thing is patient care items not disinfected properly. This was a huge thing whenever the pandemic came out. We didn't get supplies. We can only get certain supplies, but we need to make sure that we know how to properly use the supply that we have and how it effectively does what it's supposed to do. So we'll go through the first one. Expired or unlabeled supplies. So most patient care items that you're going to get will have an expiration date or have manufacturer guidelines as to how long the supply is good for, or what the length of time that you can use that product for is. A lot of times when I'm working with clinics, we have a policy and procedure that talks about this. And as a clinic, you can determine if you want to set a timeline for the expiration of your equipment or supplies, or if you want to go out of the stated expiration date on those supplies. So you want to make sure that whatever you're doing, you're following those. If your policy says that after 30 days, we're throwing it, you want to make sure that you label and date that for when you open it so that you can keep track of if it's 30 days has passed, that you throw that away. This is the same thing for hospitals, but we saw this a lot more in clinics where sometimes we don't use certain pieces of, some medical supplies or pieces of equipment, and we find that those fall out or those haven't been inspected. Third is a common finding is that glucometers require that solutions and the strips be used for a period of time. So based off of your manufacturer, you want to make sure you look at your glucometer and your strips. And if they say that after 30 days, once this is open, we need to chunk these and get a new set, then we need to make sure that we're following that. Now, how do we measure if 30 days has passed? Label and dating. We want to make sure that we label the date that we open those things, put an initial by just to verify it. And then the last things is what we found is that when we bring things into the clinic, whether it's a new piece of patient care equipment, or it's a new table, or it's a new chair, anything that can be used for the care of a patient, we need to make sure that it has been inspected before we put it into use. What we find a lot of times is that we bring new things into the clinic setting and it has not been inspected by our biomedical supplier or by whoever we use, and that we need to ticket that, or that it's been tagged, but the tag is out of date. So that's something that as you make your rounds around the clinic, making sure that those inspections are up to date. All right, moving on, sterilization, high-level disinfection. These are the same things that we talked about, and I have that booster pack up here, but in the clinic setting, the common lapses are insufficient training or lack of competencies in sterilization, high-level disinfection equipment. So whoever's doing that in your clinic, making sure that they are competent, making sure that they've been trained, making sure that they're doing the process correctly. Improper storage of caustic chemicals. So if we're storing chemicals and there's a warning on that, making sure that we're storing those properly, and maybe not with supplies that they don't need to be stored with, or are going to cause irritation. If it's an eye irritant, or if it's a smell irritant, we want to make sure that those are stored away from either patient care or where our employees are, to make sure that they don't have ill effects. Manufacturers' guidelines are undermined by shortcuts. So a lot of times, whenever we talk about processing or cold sterilization or using different chemicals like Cydex OPA or different things that we use in the clinic, we want to make sure that we're following those manufacturers' guidelines. A lot of times that clinic setting may not be set up for that, but we want to have an area to where we can follow that process, do it correctly, and make sure that when they do come by, they can follow the process and they know we're doing all those steps when they read those. This is a big one. Solutions that are in containers are not labeled. The biggest thing a surveyor can say is, I've got a dish, I open it up, what is it? Is it barbicide? Is it Listerine? Or is it Cydex OPA? We don't even know. But making sure that you label those chemicals, if you're using those, with what it is, and then also if it's got an expiration date or a date where you need to throw it out, that it's labeled on there as well. And no documentation of the process to verify it was completed. So some clinics that we've worked with, they use these processes, but they have no documentation of when instruments went in, when they were taken out, of how the process was done, of sterilization logs. They just don't have any documentation. You want to make sure that you evidence anything that you do when it comes to sterilization, high-level disinfection, to the finest detail, to make sure that if they go back and they pull something, that they can evidence that it was processed correctly. And the last thing is proper disinfection. So like we were talking about, dwell time, contact time, kill time, you've probably heard of those different things, but what that is the appropriate amount of time that a disinfection has to be, or disinfectant has to be visibly moist on a surface being cleaned to effectively kill germs, viruses, bacteria, whatever that you're doing. During COVID-19, we were getting everything. We were going to the dollar store to get Clorox wipes. We were going to Family Dollar or Walmart to get Fabulous. I mean, everybody was using what they could get. So a lot of times what we'll see is the fallout from that is we'll have chemicals in our clinic setting that we don't even know if they are healthcare grade, and we don't know what the dwell time or the kill time is. So we really want to make sure that whatever you have in your clinic, number one, has been approved to be used, is appropriate for the healthcare setting, but is also being used properly. So common lapses that we find in surveyors are the staff, whenever the surveyor asks, how do you clean this room? They will show how they clean that, but they don't use the proper dwell time. I got an example. You can see usually they call it a contact time, and it has to stay wet for a certain amount of time. So make sure you identify that on what you're using. The second thing is not being able to verbalize the dwell time. You know, a big practice that we always recommend in a clinic setting is if you have bottles, so just go ahead and circle it. A lot of times the dwell time or the kill time's on the front of the bottle. Just go ahead and circle that, and make up an acronym with it. Something easy to remember, so that when they're in the moment, or they're talking to those surveyors, or they're doing that disinfection, they're doing it properly and they know what the kill time is. Third thing is not able to identify if a room or item has been cleaned. So do you have a process? Let's say a patient is left. What's our process in a clinic setting? Do we wipe everything down? Do we pull the paper and we know that when the paper is pulled that it's been cleaned? Or do we have a process where the door is closed, that it's dirty, and when the door is open, it's clean? Do we have signage? What is your process? Because a lot of times, whether it be your patient room, whether it be your patient care supplies, like a glucometer or like a blood pressure cuff, how are we evidencing that those things have been cleaned? We just need a process. There's no right or wrong way to do it. You just have to be able to evidence it whenever they ask. And the last is not wearing proper protective items. So some of the chemicals that you may be using, I know this year we've been surprised. Some of the things that we've been using call for much more protection. They call for goggles and face shields, and we weren't using that. So that was something that was a learning point for us, is making sure that whatever we use, we're cleaning with it properly and we're protecting our staff, or if we have contractors, that they're protected as well. Okay, that is our first webinar. Just to recap, I'll go back through this. So here are our webinar dates. Again, like I said, the basics are going to be your foundation. The advanced are going to be more technical information. And each of this is going to be catered to hospitals and clinics. So we're going to talk about specific challenges that you face and the things that you need to have in place. The second thing is your assessment application. So it is live in the chat right now. So you can go in the chat, you can click on that and you can complete that. Make sure you get in there so that we can count you in. And like I said, we have 10 rural hospital spots and we have 30 rural health clinic spots. So we definitely want to work with you on that front. And the last thing is thank you. No, we are, I know working with Danae has been a pleasure. It always has been, but we are super excited. This is what we love as a board certified preventionist. I mean, I live and breathe this stuff, and I try to make solutions that are easy to put in place, but you're able to continue those moving forward. It's not like a radical change. So we look forward to working with you. We look forward to, getting some feedback from you, what you'd like to see, what you'd like to get in your PPE. And again, if you have any questions specific to the program, I've got the LRHA's link right here. Danae would be happy to answer those. And then also I've got our office number right here, a support email if you have questions. And then also you can visit our website for more information. But with that, I just want to thank everybody for coming to this first one, and we look forward to working with you in the future. So Danae, you could take it from here.
All right, thanks so much. So I just launched a poll. You should get a pop-up. Just do a quick pulse check to make sure that what we're delivering to you is valuable. So please go ahead and answer those questions really quickly before we jump off today. Thanks so much, Taylor, for being here today, for delivering this content. You will also get kind of a longer survey. I think it'll pop up when you exit, but you'll also get a link via email. Please do complete that survey. That's part of our evaluation of the project as a whole, and to make sure that we're delivering you good content. So please do take that for us. Again, a recording of the webinar will be on our website in the next couple of days. That link is in the chat. And then, as always, please feel free to reach out to us at LRHA if you have any questions, if we can support you in any way. My email address is in the chat, and Taylor's email address is also in the chat if you have any infection prevention specific questions. And so with that, we will wrap up for today. Thank you so much for joining us, and we look forward to working with you guys in the future. Thanks so much.